Hey guys, welcome back to Defeating Hair Loss. My name is Steve. I want to help you with all your hair transplant, post-op surgery questions. Got a question from a patient out there watching these videos. Hey Steve, I feel like I've got some bumps on my scalp after I've had my hair transplant. It might be about 30 or 45 days post-op. What the heck is going on? And my answer to him is, as long as you went to the right clinic, right doctor, you shouldn't have anything to worry about. Be very careful with your fingers, your fingernails in your post-op care. Do not bring any dirt or anything to those grafts that are still healing, because what can happen is if you get a little bit of dirt up in your scalp, that the hair is coming through and then the actual site or hole, for lack of a better word, will start to close and bacteria will slide down the shaft of the hair and get trapped under the skin, and that creates what we call a pimple. Now, there's nothing, some people call it a cyst. Some of these things can get really kind of like marbly. Like I've actually had a couple in my life through different hair transplant procedures that feel like a marble in your scalp, and you think something's wrong. If you're freaking out, stop freaking out. And of course, you know what I'm gonna tell you, call your hair transplant doctor. The best thing you can do is apply a warm compress. The worst thing you can do is, of course, panic. And the second worst thing you can do is try to pop this thing. Now, if you try to pop this pimple, there's a chance that that graft can fly out. Now, I think I've had that happen to myself. There was a lot of pus, and I didn't have guidance. This was years and years and years ago. And I'm admitting it now in front of you. I don't want to say that I destroyed a graft because there's only so many on our scalps, and I want all the hair I can get, obviously. So this can happen to patients that have curly hair. Actually, can happen to patients that have any kind of hair. But the curlier the hair, the more that opportunity for the hair to be trapped underneath the skin. A lot like, anyone that has kind of curly or really strong hair and a beard. A lot of African American men can get some ingrown hairs in their beard. That can happen in the donor zone. That can happen in the recipient area as well. So the wavier your hair, the curlier your hair, the stronger your hair, can create some of these kind of ingrown hairs, and can also happen in the suture line if it's an FUT. Apply the warm compress, keep your dirty hands and fingers, and keep in mind when I say that, I'm not accusing you of walking around with dirty hands, but our hands, our fingernails, our fingers are constantly being loaded with germs. So either use gloves or make sure you wash your hands really well if you go near that area. Don't worry if you're shampooing, that's going to obviously clean everything. But keep the area clean and dry, apply warm compress. And if you get scared and you get that marble kind of cyst, some patients call it, go see your doctor. And sometimes they can lance it a little bit and just kind of use some relief from that pus that's underneath that skin. Eventually it's going to come out anyway, that pus, but it does feel kind of freaky that you think something's wrong. There's nothing that's wrong. Nothing's going to happen. It's not going to create any major infection as long as you keep your fingers and hands away from it. So these can be called post-op pimples, ingrown hairs, some patients cysts. I wouldn't really call them a cyst, but yeah, this can happen. It's totally normal, and it'll all work its way out. And I hope this helps you. Don't forget to like and subscribe.